Okay, this video is what to say to a breast cancer patient. A lady friend of mine today just asked me that her friend's newly diagnosed with breast cancer. She just had a biopsy. She hasn't had surgery yet. She's wondering what can she do to live longer. And so, first thing is the fact that she's looking for information, that's a good sign. Most patients just go straight to an oncologist and just do whatever they're told. And that's actually kind of stupid. I mean, it's good to talk to oncologists, see what you can learn from them, but the patients with the best outcomes are the ones that take a strong involvement in their own care and try to learn as much as they can about their disease. Whatever the disease is, breast cancer, any other type of cancer, any disease, a well-informed person can make wiser choices. So there's a lot of things the individual can do. You're not just dependent on your doctor. There's things you can do. For example, when you exercise a lot, you keep your body moving. Your heart pumps blood into your arteries, and then that pushes the blood through the veins. But the lymphatic vessels run parallel to all your arteries and veins, but they don't have a heart. So the way you pump your lymphatics is by exercise. And our ancestors walked, who knows, 15 miles a day or something. So you want to be exercising a lot because when your white blood cells, they move around through the lymph, and when they circulate, they're better able to remove cancer cells. One little tumor the size of a thumbnail can release 1 million cancer cells into the blood every day. It's your immune system that removes that. And so you want to optimize function of your immune system. The way you do that is exercise a lot. Also, you want to avoid things that turn off the immune system. So you got to get your sleep. Get to bed early. That's the most important thing typically for getting to sleep. Get to bed early so that you get more sleep and your immune system will work better. In addition, it's good to stay warm. When you're warm, think about your body when you have a fever, you have an infection. That fever gets the white blood cells to move around faster so they can do everything they need to do to find the cancer cells, to find the metastasizing cells and remove them from your body. The immune system works great at these things, okay? And then you also, if you're going to get chemo, you want to look very strongly. Does it actually work? If there's some cancers chemo works well for, some lymphomas, some leukemias, testicular cancer, and some other cancers. Okay, then go ahead and get your chemo. But if you see that the chemo doesn't work well for your cancer, then why get it? There's often an assumption in conventional medicine, the patient's already dead, might as well give chemo a try. But what I'm saying is chemo works well for some cancers. It doesn't work well for other cancers. Make sure you know the results of chemo, because if you just take it for the heck of it, you're definitely going to get the side effects. Whether or not you get a benefit, that depends, okay? What else? So I said stay warm, get a lot of exercise, start reading a lot about your disease, and then read about other people with good outcomes. For example, with breast cancer, these three ladies here, Ruth, Janet, and Lorraine, Lorraine's down here, they all survived metastatic breast cancer for multiple decades. So I would study what they did. In general, all three of them went low-fat, vegan. That would be a guaranteed thing with no oil. Guaranteed, that's a wise thing to do. Chris Work's an interesting guy. He had a colon cancer, and he survived poor prognosis, colon cancer for a long time. What else? You want to eat the reason for eating the low-fat vegan diet is multiple reasons. Number one, you get better blood flow to the tumor. I recommend low sodium too because it's a vasoconstrictor. Okay, the plant food's got everything you want. They got the potassium and the sodium, the electrolytes, and the magnesium. They got potassium and magnesium, which are vasodilators to get more blood flow to your tissues. Okay, there's a competition between cancer and the normal adjacent cells. Good blood flow, good oxygenation, alkaline diet, they all favor the normal cells over the cancer cells. Vegan diet provides everything. Prevents leaky gut. It's an alkaline types of food, especially the fruits and vegetables. And the grains are only a tiny bit acidic compared to meat that's super acidic. Okay, what else? Being thin is a good prognostic sign, so you eat this diet, it makes you thin. Avoid processed food. It tends to be high in mitochondria inhibitors. Be careful about all those medications. I gave previous lectures on mitochondria inhibitors. There's a whole bunch of them. A lot of them are common. But processed food is full of mold inhibitors, also called fungal inhibitors, and those are often routinely mitochondrial inhibitors. I would check my ferritin level. I'd probably want to keep it about 30 to 80. It'll decrease oxidative stress. You're trying to basically take all the burdens off your body so it can focus on healing. I would avoid all the estrogenics because they can potentially promote proliferation of breast cancer cells. No deodorant. I made lectures about all this stuff before. So I would avoid estrogenic chemicals in every form, in the food, in deodorants, personal care products, shampoos, etc., etc. They're in tons of products. That's why it's good to simplify your life. When you make your life simple, you can just focus your energy on the things that matter and not be distracted with BS and not be nickel and dime from a bunch of peripheral things that you're not even thinking about. There's estrogenics. Like I don't even use laundry detergent. There's full of estrogenics. Same thing, I don't use those dryer squares or something to prevent wrinkles. So what? Okay, minimize your stress because stress, the body has limited resources in a fight or flight situation, being chased by a saber-toothed tiger, okay? Your immune system is designed for that, to ramp you up for the next 20 minutes, next half hour so you can survive. But there's limited, glucose in the blood and other resources. So what the stress response does, elevated cortisol, it shuts off your immune system. Well, you need your immune system to fight the cancer. So you don't want to shut off your immune system. So try to avoid unnecessary stress. Things that optimize function of the immune system are things that put you in a positive mind state, an attitude of gratitude. A lot of us say, well, I'm half screwed. Well, you know what? A lot of people are totally screwed. So if you're only half screwed, you're doing pretty well compared to most people. Okay, seek positive people that sort of make you feel better. Avoid negative people. Listen to positive music. I love Christian music. It puts me in a great mood. It's so soothing. It's wonderful. Religious people live longer. They're healthier. In a sense, you sort of give over some of your stress to God. Ask Him to handle it. Put yourself in His hands. Prayer often helps people. If you have some type of purpose in your life, that often helps a person, whatever it might be. Like if you have a child, help your child, okay, whatever it is. You have a parent who's sick, help your parent. Whatever, the psychology of just doing something positive for other people, it releases reward neurotransmitters in our brain that makes us feel better and happier and makes us more resilient. Having at least one thing that we're enthusiastic for about getting out of bed in the morning. Get your sunshine, your vitamin D from the sun is the best way to get vitamin D. It improves your immune system function. Keep track of all your medical records. Get copies of any type of imaging test you have so you can, if you have to go to another doctor, you've got copies of everything. You can show it to them. Keep a journal of your experience too. That might be helpful to you, and keep studying your disease. Watch more videos on cancer. I would say you definitely want to watch Dr. McDougall. That's the best introduction to breast cancer video you're going to find. You can see the T. Colin Campbell videos about avoiding animal protein. The Kelly Turner book is really good about radical remission, patients who survive breast cancer, and not just breast cancer, any type of metastatic cancer. What did they do? The John Kelly book, Stop Feeding Your Cancer. Chris Wark is good, especially for like religious advice. Ruth, Janet, Lorraine, they're all real good. China Study is a good book, but basically the whole point of China Study is don't eat anything from an animal. Nothing at all from an animal. Okay, you want zero animal protein. So anyways, you can watch my videos. My videos are going to be a little more advanced. I would do all the other stuff first before you're ready to get to my stuff. It's a little bit more advanced, more molecular biology and stuff. Anyways, I hope this is healthy, and there's a lot of stuff you could do